Across Canada, we are very proud of our universal public healthcare system, but most Canadians agree we could still do better. Within our public system, we could improve timeliness and accessibility of services, making sure all Canadians have access to a primary care team close to home. We could do a better job preventing illness, not just treating it. We could better integrate healthcare services with social services, breaking down silos and putting people at the center. And we could give Canadians more of a voice in what all these services look like at a local level, since no two communities are identical. Canadians want and deserve a more responsive, integrated, and people-centered approach from their health and social service systems. The exciting news is there's a powerful model to achieve this called Community Health Centres. Across Canada, community health centres already play an important role in our country's healthcare and social service systems. Community health centres provide a wide range of day-to-day health and social services within a single organization, all to meet the needs of individuals, families, and groups within their local community. It's an innovative model that actually dates back to 1926, when Canada's first community health centre was established in Winnipeg. Since then, community health centres have gradually been established in more and more local communities across Canada, putting people and community at the heart of it all. Because they are local organizations governed by members of the community in which they're located, community health centres typically have their own unique organizational name, something that captures the individual story and history of each place. But there are several key characteristics that make up a community health centre, no matter where it's located. Community health centres deliver primary care services through an interprofessional team of diverse healthcare providers, including physicians, nurse practitioners, nurses, counselors, social workers, and other health professionals. This makes best use of available health professionals, and it draws from the strengths and skills of the diverse care providers that make up the team.
One of the things we hear regularly in terms of feedback from the people we serve, that they like being attached to a team as opposed to one practitioner, and that they can do lots of things in one place, so a wide variety of kinds of services, so lab, x-ray, foot care, wound care, a psychologist, psychiatrist, pediatricians, all kinds of services all in one place. So they're not trying to get here, there, and every place to try to follow up and find what they need.
So community health centers, to me, are the best way that we can deliver health and well-being to people, because for me, what they do is they start with a person at the center, and they look at what those needs may be, whether that's dental, medical, nursing, physio, but whatever that is, we're able to accommodate and address what that person needs in order to be well. In the traditional model in Canada, a lot of people attend primary care in a doctor's office, where it's just a family doctor there providing service alone. But in our model, we work strongly with our nursing, pharmacy, and other allied health team members to fill the various needs that that patient may have for their care. So we recognize that health is something that involves many areas in order for someone to have a sense of well-being, and to better address that, it involves a lot of different people with different strengths rather than just a family physician. For myself, I get a lot more professional satisfaction by working as a part of a team. There's a strong sense of camaraderie and friendship. We are able to brainstorm and problem solve in ways that I wouldn't be able to do on my own, and kind of share what can sometimes be a very difficult job together. So it's very satisfying for me as a physician. And most importantly for our patients, I feel at the end of the day they get better care, and working as a team we're able to provide better solutions for our patients.
It's a place where people matter and people come first.
I've got 110 over 65.
They care.
That's excellent.
They go out of the way.
Oh, that's good to hear.
It's a great medical home away from home. They promote community and caring for people, and people need to be cared about, and they need to go somewhere where it's safe, and they can count on people, looking forward to seeing them or welcoming them, and not disregarding them or all that kind of stuff. And community health centers, I mean, they're so different than the regular medical model. They're a wider, broader model that offers so many choices and options.
But CHCs go beyond providing high-quality primary care. They also provide health promotion services and programs in both individual and group settings to help people manage their illness and learn how to keep up their health and well-being. This focus on preventing illness extends into the community and onto social factors that are the greatest causes of poor health and which are barriers to accessing care and support. Things like housing, transportation, stable income and employment, food security, and other social factors. Community health centers have programs and partnerships to address many of these social determinants of health, focusing in on the issues that are the most relevant in the local community.
So here are the details for tomorrow's job.
I don't see a private medical office working with people in a community garden. Create a youth center, create walk club for people, working in mental health with group support, having a session how to understand the heart disease and things like that, do some health promotion and health prevention. And also working in partnerships with the food bank, legal aids and things like that. This is basically what we are doing every day.
So I think that community health centers are one of the clear answers around health equity in this system. That working with people who have the least access, experience the greatest barriers, often provides an opportunity to get the primary health care and related health and services that you need. So community health centers fill that void. They do so in a tremendous way by looking at whole person and by addressing whole person needs. So it's not just the physical care, but also looking at the other needs that people bring that affect their health and well-being. And that can be housing, it can be employment, it can be discrimination, it can be cultural incompetence, a range of issues that affect how people are able to be well or to attain a better sense of well-being from whatever they are in life.
As important as all of this is, though, health and social service professionals can't do this work alone. They don't have all the knowledge, and they're not the experts about what the issues are in the local community. That's why community health centers involve members of the community in various aspects of the organization, including governance of community health centers as not-for-profit organizations. Community members help set priorities for services and programs. They help build connections and relationships of trust in the community, and they enable the organization to adapt and respond as needed.
I think one of the great things about CHCs is that they look different everywhere, even within a province. And I think that's what comes from local governance and community governance, is that a CHC is really built to reflect and represent and service the community that it's designed to work with, whether that's a geographic community or whatever. We can provide services that are often very much more responsive than larger systems. We can identify an issue quickly, locally, and respond to that. So I think our ability to be able to do that, to be able to be nimble, to be able to work with communities really makes community health the most effective primary care interventions and community health interventions.
In doing all of this work, community health centers champion health for all. CHCs take measures to ensure that their services, programs, and partnerships reduce health and social inequities faced by different groups. This means making sure that groups impacted by different types of social exclusion are actively involved in helping shape services and programs. Community health centers strive to ensure that their services are welcoming, accessible, culturally responsive, and appropriate.
I think those are the most important things that the community health centers can bring to any community areas, to strengthen the capacity of the community, help individuals to address their health and their health-related needs, and to strengthen individuals in their own personal abilities to address their health issues, their life issues, and move to a better sense of wellness.
Our job isn't just to deal with the physical, the individual walking through that door coming in for supports around illness. We've had to deal with the social issues, the mental issues, and the spiritual issues. So the uniqueness of a community health center is that you're dealing with all those facets of that individual journey. And here, I think our people come for their culture. They reconnect to who it is that they are. And they can only find it within these structures because they don't see themselves in cities, but they see themselves once they walk through this door. This place is their place. It is a place of belonging.
Community health centers are already making a tremendous impact in the lives of individuals, families, and groups in the communities they serve. In addition to their local work, Canada's CHCs work closely with each other and their associations at provincial, national, and international levels to share innovative practices and to improve quality and impact together. This adds millions of dollars worth of added value to Canada's health and social service systems each year. But the availability of CHCs still varies greatly by province and town. It's a major challenge for Canadians and one we need federal, provincial, and municipal governments across the country to address together. It doesn't necessarily mean our governments need to spend more. It starts with spending our current health and social service resources across Canada more effectively on integrated community solutions like community health centers. We can't afford not to take up this challenge.
If you have a good health system in your community, locally, I think it is good economically for the region. And, you know, on the one hand, you're serving people, and on the other hand, you're building the economy at the same time.
Many communities across Canada have been waiting for decades for governments to invest in this transformative change. Some have decided to start the process themselves, rolling up their sleeves and pulling the community together to launch a community health center through their own fundraising within the community.
Well, the people that are on my board come from a variety of backgrounds, but all dedicated to one cause, and that's to improve the delivery of healthcare services on our island and see a community-based, community-operated health center as the vehicle to do that.
Many communities are just getting started, hoping the federal government or their provincial government will support what patients and communities are asking for.
What we have now is a series of doctors and other allied services typically run as private businesses at various locations that don't necessarily interact with each other in the healthiest of ways. And what we're going to be doing is pulling it together where people work together, and it's centered not around the need of the practitioner, but centered around the need of the resident or the patient.
This community leadership is inspiring, but Canadians need our federal, provincial, and municipal governments and our health system leaders to do their part too.
I believe that our current system, where we're working in fee-for-service for physicians, unfortunately doesn't allow the flexibility to include many of the other ancillary services that people require for their health. But if it was in a more flexible funding model, which could be delivered federally, then we would be able to better support the growth of team-based care. Community health centers truly, it puts the power back into the community to meet that community's health needs in a way that has been shown to be successful, cost-effective, and really very enjoyable as an employee to work there. So I think community health centers are the best way for us to continue to deliver care that is sustainable and truly meeting the needs that exist.
And they've already proven that what it is that they do works. And what it is that they do, people want. And there are not enough resources that are placed into our hands to do that kind of caring work. So we need to have this kind of model of care permeate through all of the province and all of Canada.
Canada's universal public healthcare system and our other public systems give us deep collective pride. They're a beacon, and they show what defines us as a country, that we believe people matter, that community matters, that we have a responsibility to each other, that we are stronger together. But it's time to take something great and make it even better. It's time for community health centers. For our health. For our future.